Yeah, Honorable Minister, my name is Anule Emmanuel for Agence France Presse. Considering that we now risk local transmission, I just want to find out from you, sir, what is the government doing to increase the number of ICUs and the number of bed spaces that we have in these ICUs, and also respirators? Thank you, sir.
Good afternoon, everyone. My name is Amaka Ude from Arise News. Well, you sort of answered one of my questions in terms of the supervision, the level of supervision, especially for those who are self-isolating. But my next question would be about our testing facilities. As it stands right now, we only have that are able to really test for the COVID-19, which are, if I'm correct, Lagos, Edo, and Abuja. I want to find out what we're doing to really upgrade some labs, even if we don't have them all across the country, at least in the geopolitical zones. I believe that would help us, in fast-tracking these samples when they're taken to the labs and get the results as soon as possible. And this will help us reduce the number of contacts that these people have, especially if they know they're positive on time. Thank you.
Good afternoon, sir. I'm Ojoma Ako Idoko from Daily Trust. My question is on private hospitals. How do you intend to include private hospitals in the COVID response? Are there some designated advanced hospitals you intend to work with? How are you going to strengthen them? Then secondly, there have been uproar, especially in the Senate, about the number of testing centers for COVID-19. For instance, in the whole northern states, there is no testing center except they come to Abuja, the southeast and all that. How do you intend to expand the number of testing centers for COVID-19?
Just one more question.
Good afternoon, Honorable Minister. Nkeshonye Ugeze is my name. I work for The Guardian. I want to find out whether you are considering having a kind of random test in all the households that, where this foreign trip have been completed. Are you considering it? Because there might be some undetected cases, maybe due to contact with someone that returned that might not really self-isolate. Then number two, I want to also find out how many respirators do we have? How many of them are working?
Okay, thank you very much, everybody. Some of the questions are quite related, so we shall address them and address one, address the others. First of all, with laboratories. When the COVID-19 first came into this country, we didn't have the capacity to test at all because, as you know, it was called the novel coronavirus, new. We didn't have a facility, and at that time our option was to take sample and send to Johannesburg for testing. Working very hard, we were able to get the reagents, and I will tell you that testing for coronavirus requires a special machine. It's a molecular diagnostic machine called a PCR, but you need a specific reagent that will identify this virus for you. So even if you have the machine and you do not have the reagent, and then you have not trained your staff, you can't use it. So you have to do a training, and then you have to make the efforts to get the reagents. The World Health Organization was quick to come and help us with training. Immediately we had acquired the first reagents. And the testing at that time was done in Abuja, Gadoa Reference Laboratory. Since then, we were able to do this test in 5 laboratories at the moment, 5. And we are looking at getting more reagents, and reagents are getting scarce because many countries are running for these reagents. And we have an offer of a PCR machine by one of the Middle East countries that want to give us one, which we want to place in Kano, where there is a gap. the 5 we have at the moment that are able to do this test, there are 2 in Lagos, that's the Nigeria Institute of Medical Research, the Lagos University Teaching Hospital, in Abuja, Gadwa NCDC. Then there are 2 research centers. One is in Ede, and one is in Irua, Edo State. Those are research centers for... That's Ede is the town. It's in Osun State, but it's in Ede town. But the one in Edo is in Irua, in Edo State. They are research centers, and they're able to do these tests. We are hoping that if we get more reagents, we shall train persons to also do this test in Abakaliki, because the machine is there, but you don't have the reagents. And I think Kano and Maiduguri, once we are able to get more reagents and do the training. So that's the capacity. And we can also include other centers where we might have PCR machines, so we're able to get PCR machines. But even the one promised us has not arrived, and that will take time. So we better reckon what we have. Meanwhile, NCDC has a very sound transport mechanism where they collect samples and send to the centers. So the patient doesn't have to physically go there. So all they do is take the samples, and they have a good courier mechanism, a courier company that works very efficiently and takes the sample to the testing center in a very short time. So that's adapting yourself to the situation you are in, which is very good. And so any sample taken anywhere can be sent to a testing center in a very short time by the courier company, which the government pays for. Now, as for local transmission, that's why I keep saying that we need to hurry up with our testing abilities to give support, particularly to Lagos State, where the majority of cases are being followed up, majority of contacts. Because the more you can get the contacts, and the more you can test them and find if they are positive or not, and put them under self-isolation, the more you can reduce the risk of them transmitting the disease to anyone. So that's a very important step indeed. And the more you're able to find all the contacts, test them, make sure they are not infectious, the less you will need an ICU, because you have fewer cases, you have fewer patient load. So that's why our strategy is on prevention. First of all, identifying those who may be coming from abroad, and of those who have arrived, tracing, and somehow or the other were not caught because they didn't have symptoms, tracing them and tracing their contacts, and finding all those who are positive, put them on observation, testing them, putting them in treatment, and to reduce the risk that we have. Because if you do not do that, each one infects the other, and the infection will spread, and you can easily lose control. So our emphasis is on that. And random tests, well, the criteria, because we have limitation in test kits, the criteria we use now is that, 1, you must have traveled in the 15 days before. 2, or you may have been a victim, or rather a contact of a person who traveled, a close contact who just came, or you have symptoms that indicate that you may have coronavirus infection. So you'll be tested. But random testing is going to be like you go hunting and start shooting into the bush, hoping that you will kill something, and you may end up with nothing. Better to aim and identify and do a more targeted use of your scarce resources. Private hospitals, yes, we know that private hospitals offer 50 to 60% of consultation to Nigerians, which is very good. They are a very powerful factor and very powerful partners in the healthcare system. So they are very, very good. And we know that a good number of patients, first of all, report to the private centers. Now, the private centers may not have, most of them don't have the facility to treat a highly infectious disease like that. And they will definitely not have a laboratory for it. But in that case, we urge private hospitals, if they have a suspected case, to refer them for diagnosis If you can hold them in isolation while getting your result, fine. Otherwise, you can refer them straight away to a center for isolation of suspect cases and get the test done and let the patient be treated in a designated IDH. Now, this is a highly contagious and infectious disease, which if you don't have a protocol for treatment, you can infect your staff in the hospital, you can infect other patients, and that will not be good. So it's better to go to a designated center instead of running the risk of having local transmission within your own private facility. So we do advise, yes, if you're a private practitioner and you get a patient who is suspicious or suspected of infection, send for testing and then send to a designated treatment center. If there are any private hospitals who wish to set up facility for treatment, well, I think they will be inspected by the relevant authorities to see if it meets the safety standards and need to be accredited to handle a disease as dangerous as this, because it's one of national security concern. Thank you, everybody.